Joe, thank you for joining us in the podcast today. Welcome to RSNA as a first-time participant. First, introduce yourself to our audience. Tell us a little bit about what TechSpring does and how it works with Baystate Health.
Sure, happy to. My name is Joe Diver, and I'm the Director of Digital Transformation for Baystate Health at TechSpring, which is the Innovation Center. And the Innovation Center strives to bring new technologies to Baystate within what we call our living lab. So if we look at the number of hospitals that we have, we also have a payer side, and we serve almost 1 million patients a year on an annual basis. So if we can look at technologies to improve the care delivery and reduce the cost of care, the biggest challenge everybody is striving for nowadays. We're all faced with the similar challenges, if you will. But the unique thing about TechSpring is that we bring our folks around the table that are frontline users to help to develop and deploy new technologies to deliver a new level of care for our community. And within our partnership with LifeImage, LifeImage has been a partner of Baystate for almost 11 years now. And so we're discussing our innovation partnership with LifeImage. We saw a great opportunity to begin to co-develop AI and leverage the LifeImage platform for that AI around a couple different categories. And when I approached physicians and providers about that opportunity, they leaned in to say, let's go ahead and collaborate together and figure this out for our community at Baystate. And then how can that replicate to other facilities across the country?
Is this the first innovation project that you've worked on that's imaging based, and why is that an important intersection at this point in healthcare?
That's a great question. It is the first innovation from an imaging perspective for TechSpring and for Baystate. And one of the things that really intrigued me at the beginning of the conversation was around how do we improve diagnostic decisions and prevent delay in diagnostic decisions. And that's became intriguing along the way as I've talked to providers about different use cases. If they could leverage AI differently, what would the use case be? And that's really where it came down to, is how can I make more improved decisions with surfacing data that I may not be privy to about the history about a patient or about the history about the patient's family or things of that nature, and what data elements will help me make a better decision. So it really was intriguing by the provider side that it can really improve care as well.
Can you talk about some of the use cases or programs that you might be exploring in order to improve patient outcomes?
Sure. One of the first ones is really patient compare. So if we see a patient that has certain conditions, how can we compare that patient to a number of other patients that have been seen in either our community or other communities, leveraging de-identified data to then be able to surface additional information for the provider, say patients like this one have had these experiences with these outcomes along the way. So think about, here's a little bit new information for you to consider. So that's one. The other one is around stroke AI. How can we improve stroke clinical processes for our community hospitals? How can we really identify the patients that need to come in for the tertiary care versus those that could be treated at the local community hospital, and begin to expand that to other organizations within our area?